Hello again, everyone, and welcome to our broadcast. I'd like to thank you for joining us today for a very timely panel discussion that will examine the use of telemedicine to triage stroke patients for endovascular clot retrieval.
So we have three panelists. We have Dr. Christine Homestead, who's an assistant professor of neurology at MUSC. That's the Medical University of South Carolina, where she's the medical director of stroke clinical services and the telehealth director of quality and education. We have Dr. Michael Mullen, a vascular neurologist and assistant professor at the Perelman School of Medicine in the University of Pennsylvania in Philadelphia, one of my favorite cities. I'm a Phillies fan, as much as I hate to admit that this year. And then last, we have from Ohio Health, up in Columbus, Ohio, we have Dr. Nirav Vora. And Nirav is an interventional neurologist, so he's a stroke neurologist and also does the intervention. So it's a panel with a wide breadth of experience, and we're going to soon throw some questions out to them because they're dealing with these like I am on a daily basis. But first, and again, how do we get the right patient to the right place? So we're going to ask the panelists, is there a minimum NIH stroke scale score that we use? For example, is it 6, is it 8, is it 10, does it vary? The second part of the question will be, is there a maximum age or a prior performance status? In other words, are you going to bring in somebody 100 years old or 90 years old? Is there any age cutoff? Or I certainly don't like to discriminate on the basis of age, but rather than using age, is there a patient who's already so disabled, for example, maybe they're in a nursing home and they require total care? Are you going to bring that patient in? The third question will be, is there a maximum time from last seen normal? In other words, are you going to restrict it to patients that you think you can get to your site to get a groin puncture in 6 hours? And that would depend upon helicopter times and how far they are away, etc. And then lastly, does the patient CT scan at the outside spoke have to have a certain aspect score? Now, some of you may not be familiar with an aspect score. This was developed up in Calgary, Canada, in Alberta, and it basically allows you to look at a scan and assign a 10-point scale. And in this case, the higher the scale, the more points, the more normal the scan is. All right, and this can be actually done online. You can be trained online. It's fairly easy to do. So that's a score that a lot of these studies used, and that most neurologists and radiologists are using, or can certainly be trained to use. Or are there other C2 criteria? I mean, do you need an MCA dent sign, etc.? So those are the questions we're going to ask the panelists to consider. Now, again, there's no right or wrong answer. These panelists all have to deal with this on a daily basis, and we're going to benefit from their experience.